even in the beginning, our own clinicians were saying, well, it may be a bad flu. But we recognized soon on that was not the case. This thing is insidious. First of all, the way that it spreads, it's spreading while you don't know it's out there. And then what happens is, like it happened to us, and I know in Utah right now, you're on that lower level of the curve, all of a sudden it took off. And then the curve started to double, and then double, and then double, and then double. And so after that aha moment that we can't do it the way that we've been doing it, there's just not enough time, we were seeing about 250 new patients, net new patients a day. We realized we had to create beds and capacity really, really quickly. And so we changed our whole operating model. It wasn't that nice, neat planning. It was turning to our regional administrators and say, you guys create beds. Just create spaces for beds. Whether it's in the cafeteria, whether it's in what used to be our auditoriums, what used to be our classrooms, what used to be our lobbies, just create spaces for beds. We've stretched our staffing ratios to 1 to 4, 1 to 4.5 in the ICU, 1 to 10 on the med-surg floors. So when I turn and think about our caregivers, they truly are heroes. You try wearing an N95 mask for a 12-hour shift. You wear it for 2 hours and it's uncomfortable as hell, okay? So these poor people are running into the fire every day. Your 50-plus caregivers coming to help us, that just gives us a sense of adrenaline. It's like, thank you. Yeah, thank you. Standing side by side with us in two of the toughest centers that we have right now, at Long Island Jewish Medical Center and Southside Hospital, and to have that kind of support coming from across the country, it means a whole lot to us. And I extend my deepest thanks to Intermountain for doing that. You're one great system for doing that. Thank you.